Good afternoon. Thank you. It's good to be back. I tried to give everyone a much-needed break from the Tate Reeves show, but I did want to come back today and provide an update on where we are with COVID-19 and what we need to do going forward. We are seeing a pretty marked global and nationwide increase in coronavirus transmission. Numbers are up all across Europe, and numbers are up all across the United States. And unfortunately, Mississippi has not been an exception in that trend. What we've seen here in our state is not a spike, and you've heard me talk about spikes before. I'm certainly not scared to use that word. It's not a spike. We've actually seen a relatively slow, slight increase over the last 6 weeks, which has really been exacerbated over the last 10 or 11 days. And we've seen much more of an uptick in the last 10 or 11 days. But if you look at our actual trends, and you can go to the State Department of Health's website, we've had a very, very slow increase over the last 5 or 6 weeks. Again, I look at date of onset of illness, not just number of new daily reported new cases, because that takes out, if you assume that the Department of Health is doing contact tracing and that they're caught up, which they are now, what date of onset of illness takes out is that variability of how long testing takes, how long it takes to get results returned, et cetera. And so we've seen a slow but uptick in total number of patients. I want to make sure that the people of Mississippi are fully understanding of where we find ourselves today. One of the things that I will tell you as I look at the data that needs to be repeated is our goal in Mississippi has never been to completely eradicate the virus. It has never been to completely eliminate the virus because we don't believe, or at least I don't, that that's a realistic goal. Our goal has always been to protect the integrity of our healthcare system such that every single Mississippian that can get better with quality care can receive that quality care. And so we look at a lot of different data points and a lot of different information, but as we come before you today here on a little after the middle of October, one of the things that has me mostly concerned is our hospital data. We talked about at our peak in late July, we had 1,250 either COVID positive or suspected COVID patients in our hospitals. That number fell down to approximately 500 3 or 4 weeks ago, and now that number has ticked back up to a little over 600 total cases. So again, we're still, in terms of COVID positive patients in our hospital, about half of where we were at our peak. However, if you look at overall trends, that's total volume of patients in our hospitals. If you look as early May, the 1st of May, we had less than 4,000 total patients in Mississippi's hospitals. Most recent data that I have, which was at the latter part of last week, we had 5,016 total patients in our hospitals. Let's talk about ICU capacity. At the peak, we had 337 COVID patients in ICU beds in Mississippi. The most recent data that I have says that we have 140 ICU patients. So we're down almost 60% in total patients in ICU beds that are confirmed COVID positive. However, if you look at the overall data, that is the total volume of ICU patients in our hospitals, we had less than 600 in early May, and we have 745 the latter part of last week. And so what that would tell you is that while our total hospitalizations and total number of patients in ICU beds as a result of COVID are significantly lower than they were at the peak back in late July, early August, overall hospital utilization and overall ICU patients volume is still up compared to where we've been at any point during this crisis. Because of that, we look at total number of COVID patients. We see that that number is increasing. And so from an aggregate standpoint, we know we have to take the necessary steps to prepare for what could come over the next 4 to 8 weeks with weather getting cooler, and to see what's happened in other states. I heard earlier today that approximately 40 states in America are seeing at least a 10% increase in total number of patients week over week. And I also saw earlier today that there were 10 states in the U.S. that had their highest single day of total coronavirus cases one day last week. Now, Mississippi is far from there, but we are at a point where when you combine the possibility and the potential of rising coronavirus cases with the fact that our hospital capacity is stretched in large part because of non-COVID reasons, it requires action. Now, here in Mississippi, we've seen this movie before. We know what can happen if we allow this to get out of control. So, we want to be proactive to prevent that from happening. Today, I will be signing an executive order that is consistent with the strategy that allowed us to successfully turn around the increase the last time that we saw significant transmission. First of all, and most importantly, we are requiring hospitals, again, to reserve 10% of their capacity for COVID patients. If they do not have 10% capacity available, they will not be able to do those elective procedures that are non-urgent, but certainly make a lot more money. That proved to be the single most valuable tool we had in decompressing our hospitals. It is essential that we do it again as we gear up for another potential increase. That piece of the executive order will apply statewide. We are also going to continue with our strategy of localized efforts to target those communities where spread is most rapid. As I've said many times throughout 2020, we have to avoid using the heavy hand of government unless it is truly necessary. We should always be as limited as possible while never ignoring the risk of inaction. I'll tell you, I don't do any of this lightly. And honestly, no governor should. But we saw this strategy work during the summer wave. As a reminder, our cases started to decline long before the statewide mask mandate went into effect. I believe it can work again. At this point, there are 9 counties that qualify for additional measures based on our standard criteria. 200 recent cases or 500 cases per 100,000 residents. The only exception to that will be counties with 200 recent cases, but that have fewer than 200 cases per 100,000 residents over that 2-week period. Those counties that will be included in the executive order are as follows: DeSoto, Jackson, Lee, Forest, Lamar, Itawamba, Neshoba, Claiborne, and Chickasaw. In those counties, social gatherings should be limited to no more than 10 people indoors or 50 people outdoors. Masks will be required in those 9 counties when indoors and interacting with the public without the ability to social distance. Now, of the 3 primary measures we are taking, none of these elements are silver bullets. I don't expect that any of these measures will eliminate the virus, and we have to allow for life to go on in the meantime. As we wait for a vaccine, our mission is the same as it ever was. It is to prevent our healthcare system from becoming overwhelmed. We're not trying to prevent any one individual from contracting the virus. At this point, months and months and months into this pandemic, you know the risk of any given action or any given activity. We're trying to prevent so many individuals from getting the virus at once that our healthcare system cannot respond. And if our healthcare system becomes overwhelmed, that means we can't respond to a car wreck or to a heart attack the right way. These decisions to protect our healthcare system can and might affect everyone, every single Mississippian. You're smart. You know what you need to do to keep safe. We're going to continue to work with our experts to set policies that mitigate rampant spread while respecting everyone's individual rights. Please stay in the game. Please stay watchful, and please be careful. We can get through this together, but we can only get through this if we're together. So thank you for joining us today, and I'm going to turn it over to Dr. Dobbs. Dr. Dobbs?
Yes. Thank you, Governor. Today we're reporting 586 new cases over the weekend, 233 from Saturday, and 353 from Sunday. We have a total of 110,592 confirmed cases with 3,171 deaths among Mississippians. We've seen an interesting transition over the past couple of weeks where the impact has been more predominant in the white community. Over 60% of new cases in the past 2 weeks are in Caucasians, and over 60% of new deaths are in Caucasians. So we've seen a significant shift and a drop proportionally within the cases and deaths in the African American community. If we look at our hospitalizations, as the governor has reviewed, we've had a significant number of COVID and non-COVID hospitalizations. In terms of COVID hospitalizations, we have a 6.7% increase in 1 week in the med-surg beds, 4.1% in ICU COVID patients, and 1.4% increase in ventilatory patients. We have 19% of ICU beds currently available, which in and of itself is not extremely abnormal, but we have 9 large health system ICUs with no current ICU capacity. If we switch over to schools, we continue to see cases and outbreaks in schools. We should have a new report today or tomorrow, but from last week we had 185 new staff cases, 343 new student cases, 565 staff on quarantine, and 6,503 students on quarantine. That total number of quarantines was roughly stable from the previous week. Again, additional information should be forthcoming from last week's reports. If we look at testing, the Department of Health is offering free testing in every county across the state. And today, starting today, we'll be doing free rapid testing at every county location where we're doing testing. And right now it's once a week in every county. Now, we are going to focus the rapid testing on those who have symptoms or who are close contacts. We've seen that random testing of rapids can give you a false negative, but on everyone else will do the PCR. Again, this is the front of the nose. And if you've had the front of the nose, as I have, it's not nearly as bad as the back of the nose, so much more comfortable. If we look at those who've gotten tested at the community sites, the majority, 82%, are community members who want to get tested because they're exposed or maybe they're symptomatic. But we have a whole bunch of other criteria for people to get tested, and they're way underutilized. Only 1% of our testing has been done for people in childcare who work in childcare settings. 7.6% have been K-12 staff, and 5.2% K-12 students. We'd love to do a lot more of that. We really want, if you're in K-12 and you're a teacher, you work in the school setting, or you're a student, get tested, please, especially if you think you might have been exposed. IHL actually has been very low. We've only done 1.6% of our testing is in IHL staff, or 1.0% in students. Now, I know that a lot of the major universities have their own testing, and that may account for some of this, but if your university doesn't have on-site testing, please come to the county testing location. We want to offer that service so that we can try to do everything we can to get around the confines of the infection. And also 1.8% of our testing is in healthcare workers. If we think about our tools that we use to contain coronavirus, there are several different ones. One of them is going to be testing. We have a testing available, but we're not doing it enough. So please, if you think you need to be tested, please don't hesitate, get tested. The second thing is contact tracing. We are at 100% outreach for contact tracing at this time. We have been able to catch up and keep up. Well, that tells you something. If we have universally available testing, and if we have universally available contact tracing and we're still growing, we need that third piece right now, especially until we get a vaccine. We need that non-pharmaceutical intervention piece, which is going to be the distancing, the masking, and the small groups. We need Mississippians to do their part. Please do your part so that we can all get through this together. And then when we get the vaccine, that'll be another tool in our toolbox that we can try to beat this virus down. And the last thing I just want to mention is masks and shields. We continue to offer surgical quality masks with face shields for people who are over 65 and over or have chronic medical conditions in preparation for voting. Thus far, we've given away 972, and you can go to the same counties where we're doing testing on the testing days. Heck, get a test and a mask on the way. We'd love to do it. So that will continue to be available free of charge. Please, if you think you need it, get the mask with the face shield. It's an added layer of protection. And Governor, that's all I have. Thank you, sir.
Thank you, Dr. Dobbs. I'm going to turn it over to Director Michelle to talk about this from an emergency management perspective.
Thank you, Governor. Thank you. Good afternoon, everyone. Just three things I want to give you an update on. First of all, we'll start off with the COVID Emergency Relief Fund for Mississippi. We talked about that a lot over the last few weeks, last couple months. The application period on that did end this past Thursday on October the 15th. All 82 counties did apply and submit projects. Far as the municipalities, most all the municipalities, less 47, did provide projects there. So far, we've approved 180 projects valued at $45.7 million, and we still have 175 projects that are pending review. For those of you that are doing the math out there, you'll see that those numbers are a little bit over the total counties and municipalities. It's basically because we had municipalities or counties submitted more than one project, so we'll be reviewing those to hopefully get them to their max allocation. Fall Severe Weather Preparedness Week is this week. The governor did sign a proclamation for that, declaring such. Each day this week, MEMA, in partnership with the National Weather Service, will be playing short videos that are going to be focusing on different topics throughout the week, emphasizing different points of severe weather. Today's is warning reception methods on how to receive your alerts for severe weather. And then finally, just a reminder, everyone, we are still in hurricane season. We did escape severe damage from Hurricane Delta, but we were not completely unscathed. We had about, as of Saturday morning, approximately 100,000 power outages. About 100 homes were affected in some way. Thus far, about $75,000 loaded in crisis track. We are still waiting on the utility damages. They were fairly significant. Still no word, though, on whether or not we'll reach any thresholds or be requesting for disaster assistance there. And then finally, on tropical update, if you've been paying attention to the news, we do have another storm formed, Tropical Storm Epsilon. It is the 26th named storm, so we are now twice above the figures that National Weather Service projected for this year. So it's been an active season. Still got a few days to go to get through this hurricane season, and we'll keep our fingers crossed on that. Governor, that concludes my update today, sir.
Thank you, Director Michelle. Thank you, Dr. Dobbs, for you and your team's hard work throughout 2020. With that, I'm going to open the floor to questions. Yes, sir.
Yes, Governor, as we approach November, this expert said there's still time if you were to issue some kind of way for people to do early voting as we go into the polls or extend the election process. Do you think that you'll look into extending the voting day so people have more time to come out to vote and be able to distance their time so they can not spread as much of the virus?
I don't anticipate changing our election laws between now and 2 weeks from tomorrow. No. What do you?
Governor, the emphasis again today on that idea of personal responsibility when it comes to masks, 73 counties that won't have a requirement unless it's at the city or county level. What do you want people to know who maybe are looking at that and saying, well, I'm not in one of those counties. I know he says I need to, but I don't have to, so surely it'll be okay if I don't.
Well, what I would say, Courtney Ann, is that, and there's been a lot of debate about the virus, and, there are those who think that, it's a hoax and it's not that important. And I'll just give you some real data from Mississippi that I personally crunched the numbers on my home calculator earlier today. If you're under the age of 50 in Mississippi, and you look at the total number of deaths compared to the total number of cases. So if you're under the age of 50 and you don't catch the virus, you're probably not going to die from the virus. But if you're under the age of 50 and you catch the virus and you are a confirmed positive case, there's a 99.7% survival rate. Right now, real data in Mississippi. We're in about the 9th month of dealing. Well, we started this in February. We didn't get our first case till March, but we're in about the 9th month of dealing with this. 99.7% chance of survival. And that's just with those who have been tested and tested positive. So we know we missed a lot of those. So that's a really, really high number. In fact, that's a number that is in line with the common flu overall. However, if you're over the age of 50, in Mississippi, real data, 93% of the folks who catch the virus survive. 7% do not. That's about 1 in 13. That's a pretty, that's not really good odds that you want your mom or your grandmom or your dad or your granddad to take. And so, a lot of folks talk about, I ought to be able to go do whatever I want to do. And generally speaking, I agree with that. However, when you put other people at risk, that is when you go away from doing the right thing and being just responsible for your own self and put other people at risk. And that's one of the things about this virus that makes it just a little bit different. It makes it a little bit harder to deal with because sometimes you as an individual may be a carrier taking it to one of those over the age of 50 that have multiple comorbidities that are at much higher risk. And therefore, you're not only putting yourself at risk because you may be perfectly fine, but do you really want to have to sit down and think, mom got it or dad got it and it was all because I didn't do things? I mean, we've seen story after story after story of that. And so we're all trying to look at the data, recognize there are things that we can do to be smart, but also understanding that there is no silver bullet. I know a lot of y'all would say, well, why don't you just throw that statewide mask mandate back on and everything will be fine? Go look at the data in Arkansas. Go look at the data in Alabama. Never have taken their statewide mask mandate off, and their curve looks much worse than ours. There is no guarantee. There is no simple solution. It takes a lot of different things. It takes all of us trying to convince each other to be smart, to do the right things. Will it help if everyone wears a mask? Will it help if everyone socially distances? Will it help if we don't gather in large crowds? Absolutely. But we're dealing with a very, very contagious virus that, at least to this point, has been something that virtually every state in America continues to deal with and will continue to do so. And so what I'm urging Mississippians to do is to wear a mask in those counties that meet the criteria that we put the mask on, the mask mandate on. We are doing this exactly the way we did back in June and July, and we think it will ultimately lead to the best outcome for Mississippi. I think we've proven that this strategy can work and will work, and I think it'll work again. Scott.
State Fair is being extended to Thursday, Friday, and Saturday. This past weekend, a ton of people down there without wearing masks. Dr. Dobbs talked about everybody doing their part. Are there risks being taken at the State Fair that you would rather not see?
Well, I think that there's no doubt that that it is an outdoor activity. It is something that can be done safely. I was not aware that it was going to be extended. I think to a certain extent we probably, at least in looking at it, we're probably relatively lucky that we had significant rains that first weekend of the fair. And so we'll continue to look at that and monitor it. If the people that are there and the people who are running it, and I certainly trust Commissioner Gibson to if he's going to have the fair an additional weekend, to do it in a safe way. I hope that the vast majority of people will be wearing masks, and I don't think that any indoor activities with large crowds is very smart at all. Yes, sir.
Governor, who do you consult with medically on decisions you make to combat COVID-19?
Medically, in terms of like doctors,
Correct.
Dr. Dobbs and his team.
Dr. Dobbs, follow-up question for you. What did you mean by you didn't learn of details when Governor Reeves make decisions until you sit down here at the press conference?
Yeah, so they had asked me something about what's going to happen Monday, and I didn't know. I didn't know until today when the governor and I spoke this morning. So, we provide information, we provide consultation, and he's the chief executive of the state. And so sometimes there are some details of that I'm not privy to until the very end. But we speak constantly, and, I go to the mansion on a regular basis and provide updates. So, but, he's the boss, and so he makes the decisions.
We have Dave Elliott with WLOX. Dave, are you there?
I sure am. Thanks so much. Governor, I have a clarification and then a question. With this limit you put of 50 at outdoor gatherings in Jackson County, does that include football games? There's certainly outdoor gatherings. And we have a major event coming up, the Peter Anderson Festival in Ocean Springs, where there are going to be thousands of people. Would it apply to something like that?
Yeah, so in terms of football games, this particular order will apply to all of those gatherings that do not otherwise have restrictive orders. And so statewide, for instance, a high school football game, we already have an order in which the limits are required. This is for social gatherings, and so certainly I'll have to look in the specifics of the festival that you mentioned, but it certainly could be looked at as a social gathering. Other thing I want to mention for your benefit, Dave, is I mentioned these counties. I want to say them again: DeSoto, Jackson, Lee, Forest, Lamar, Itawamba, Neshoba, Claiborne, and Chickasaw. One of the counties that is not currently on the list but could be added and could be added soon is Harrison County. Two others are Hinds County and Rankin County. All three of those counties are obviously three of the largest counties in the state. They all had more than 200 cases within the last 2 weeks, but they did not meet that over 200 per 100,000 residents threshold. We didn't want to punish them or penalize them because they happen to be larger counties. You look at Hinds, for instance. Hinds certainly within two of the last 3 weeks has had significantly declining cases overall, even though they're still above that 200 number. But we're going to monitor those three counties very, very closely. Harrison, I specifically mentioned that because while it did not meet the threshold, and by the way, people have asked why that threshold. From my perspective, the White House says, and we've gone back and forth with them on this, they look at, on a 1 week basis, 100 cases per 100,000 as being in the red zone. The equivalent of that, of course, is since we do in 2 week numbers, which was Dr. Dobbs' original suggestion, which I think is exactly right because it gives you a better feel. But if you're looking, if 100 per 100,000 over 1 week is red zone, according to the White House, we wanted to look at it from 200 and 200,000. I say all that simply to say Harrison County, Dave, is a county that does not meet that threshold, but it's not very far off. And so we're hopeful that the citizens of Harrison County will step up and help us reduce the total number of cases and reduce the overall spread. If not, we will have to add Harrison County to the list relatively soon. It's not in this executive order, but as we did in June and July and August, we are certainly willing to add counties should it become necessary and should they meet the criteria.
Dr. Dobbs, you too, Governor Reeves. We're moving into the colder months, but also the time for holidays where people are going to be gathering at homes, closer indoors. The barbecues aren't happening, they're cooking inside. What's your concern about that? And kind of paint the picture for people out there who host mass gatherings inside.
Well, I'll just say from a public health perspective, a lot of the transmission does occur within family groups. And when we have people coming in from out of town, getting together, there was we tested some folks recently at a outbreak at one of our colleges. Someone went to a wedding and got it and brought it back. It's whenever we get folks together in social groups and they let their guard down and they're in close proximity indoors, it's a high-risk endeavor. I would recommend that we limit the size of our holiday gatherings. I would recommend that we keep it as much as possible to nuclear close families. And then when you can, take some simple measures. When you can, my own father came by yesterday, and when we had dinner, we left the door open and the window open and stayed 6 feet apart, just to be extra careful. So I think there are things that we can do. It's going to be important not to let our guard down. And I missed my cousin's wedding. I didn't go to several family events recently because I don't want to endanger them or to risk spread and bringing it back to my coworkers and my family. So it spreads. That's a risk. It's an opportunity for us to let our guard down. So please be very cautious.
What I would say is if Thanksgiving 2020 is exactly like Thanksgiving 2019 and 2018 in terms of the gatherings that we have, transmission's going to go up. I think that's just a fact. And so I'm certainly, as the governor, not going to sit here and tell you don't have Thanksgiving or don't gather with your family, because I think that's important. But by the same token, recognize that there is risk associated with it, and to the extent that we can reduce the size of those gatherings, reduce that risk, monitor it closely. Look, it is still the middle of October. Thanksgiving is 5 or 6 weeks away. The best way for there not to be any transmission at Thanksgiving events is for us over the next few weeks to really turn down the total amount of cases, positive cases in Mississippi, so as to cut them in half or even more, because the best way for there not to be coronavirus spread at your Thanksgiving dinner is for no one there to have the virus. And the best way for no one there to have the virus is if we can be successful, wear a mask, be smart over the next 3 or 4 weeks, and that'll really help us turn it around.
Nick Juden with Jackson Free Press.
Hi, yes, thank you. Governor Reeves, Mississippi is looking at Election Day during an extremely high degree of community transmission. Mississippi has the most restrictive early and absentee voting policies in the nation. Dr. Dobbs has said he's genuinely concerned about transmission at polling places. Looking at the rising numbers, what new provisions is your administration planning for ensuring safe polling places? And I will have a follow-up. Thank you.
Well, thank you, Nick. Mississippi, over the last 7-8 months, has had multiple elections. They have been run in a safe, responsible way, and I have every confidence that we will go into the general election in which that is going to be the case. I believe that the vast majority of people that go vote will be wearing a mask as well. I would recommend them doing so, and I think that if you look at, for instance, the elections that we had last Tuesday, we had 4 elections throughout Mississippi, and I don't remember the exact number of counties that were included in those 4 elections, but I know that it was Lowndes and Oktibbeha and Lincoln and Lawrence and probably 10 to 15% of our entire electorate voted last Tuesday, and I have not been made aware of one case of transmission caused because of that. I'm not telling you that it's not, but we know how to run elections. We've done it in Humphreys County this year, and we'll continue to do so. If you're over the age of 65, you have the ability to absentee vote in our state. That's clearly where the most risk is, but should that be something that makes you feel better, then you certainly have the ability to do so.
Nick, did you have a follow-up?
Hi, yes, thank you. So Dr. Dobbs, you told me on Friday that Mississippi still has the possibility of providing, for example, outdoor masking stations at every polling place in the state. Governor Reeves, as you know, droplet transmission is the most dangerous form of viral spread and cannot be prevented without everyone in an enclosed space wearing masks. If the state can actively provide free masks to all voters at the polling place, would you mandate that? And if not, what specific provisions of law do you say make it unconstitutional?
So, Nick, you'd asked me if we could do it, but and we certainly, I suspect we could. But there are going to be masks available anyway, I believe, at the polling places. So I think that that's pretty much been accomplished. And certainly, we want to make masks available, and for those who are at high risk, they're available. And if we need to give out more masks to other folks, we'd be very, very happy to do it beforehand. That certainly makes a lot of sense to go ahead and be working ahead of time.
Yeah, I would just simply say, Nick, we have handed out over 2 million masks to people across Mississippi. Mississippi has 3 million people. We've handed out 2 million masks in the communities throughout the state. The fact is that we have also worked with Secretary Watson and his team. We have distributed a mask to every polling location, or at least the mask to each county to make them available. And so I believe that Mississippi is going to have a safe election. I believe that we have done everything in our power to ensure that it is safe. Mississippians know the risk, and the vast majority of Mississippians, should they go indoors to vote, are going to wear a mask, and they're going to do it, and they're going to stay socially distanced, and the election is going to turn out just exactly like the election did last Tuesday, in which literally tens of thousands of people voted last Tuesday, and in the election 2 weeks from tomorrow, hundreds of thousands of Mississippians will go vote, and I believe it will be done in a safe, responsible way.
All right, Leo with Associated Press.
Thank you. Governor Reeves, did you ever test positive for the coronavirus after the president had it? I know you said you tested negative once, but I wanted to ask if you were tested again once or more after that time and what the results of those tests were.
Well, Lee, I have to be careful here because, the president likes to say, that he had a positive test. I had positive outcomes. I did get tested after the initial test, which was on that Friday, and fortunately, it did come back negative. So I've had multiple tests since visiting the White House, and they have all been negative to date.
All right, Jeff Pender.
Governor, if it's okay, I have two questions, one for you and one for Dr. Dobbs. First one is rapid testing in schools. You had said that was forthcoming. Is that being done now? How's that going? And are teachers being tested every day?
The rapid test, and I'll let Dr. Dobbs speak to the specifics, but the direction that we went in was to provide the rapid test for the individual testing locations that we have in all 82 counties. And so testing is now effective, I think effective today, available every single day in every single county for those in our public schools. It has been available, I believe, on a weekly basis, at least once a week in every county, but now it'll be available on a daily basis starting this week.
Yeah, and I was like, we're working toward weekly. I'm sorry, we're not quite to weekly yet. Oh yeah, but it's going to be at every county location as scheduled. So that's one of the reasons why I want people in K-12 to go ahead and get tested now, It's available. It's in every county. We're also looking at other partners. We've already used some of these rapid tests for long-term care settings in the state veterans homes to support their safety measures. One of the challenges is this is a CLIA wave test. You actually have to have a clinic administer the test. You can't just give it to the principal and have them spread it out. So we're finding partners, trying to make it widely available. It is, so please get tested. If you're K-12, you want to come by every day, come on by. We'd love to see you. We want to make sure that we do everything we can to keep our kids safe.
I would just say, because I've heard a lot of people who have been tested the old traditional way. The rapid test is front of the nose, not back of the brain, and so it is a much easier test. I've been tested many times. I'm sure Dr. Dobbs has as well. But it is a much less invasive test, and you can literally get a result within 15 minutes or so.
All right, we have Hunter Dawkins.
Yes, ma'am. Thank you, Governor. Question for you, or Dr. Dobbs. Recently, in the White House, during a campaign rally, the president mentioned a possibility of going to herd immunity. Governor, you remember a few months ago, you and I spoke on the same question. Is your opinion about this matter changed, or have you spoken with somebody from the White House? Just give me a backdrop of that.
I would simply say I can't tell you what the percentage of Mississippians would need to have the virus to reach herd immunity, but what I would tell you is I don't think herd immunity is an effective strategy unless and until vaccines are readily available across the board.
We have Dave Elliott with another question.
Well, thank you. Governor, let's go back to Harrison County for just a second, if we could.
Sure.
It does not meet the per 100,000 formula, but as you pointed out, we are right on the razor's edge of that. You said from the very beginning that counties and cities do have the authority to issue orders of their own. If local leaders in Harrison County think it's warranted, would you encourage them to take action on their own?
Well, I would tell you that if they believe that it's warranted for their local community, I always believe that local governments have the ability and the authority to issue orders, and many of our local municipalities have done just that. But again, I know everybody thinks that a mask mandate is something that is just the silver bullet and it makes the virus go away. We added Forest, we added Lamar, and we added Lee counties today. 3 of the 9 counties right there. And I think everyone in the press knows the actions that have been taken by the cities of Tupelo and the city of Hattiesburg. They've been very, very aggressive on the mandates that they have put in place. Just simply having local governments or state government or the federal government or any other big government tell people what to do, while I think it certainly helps that we're raising the importance of it today, and I think we'll get significantly better participation in those counties, understand that just writing something down on a sheet of paper does not guarantee that it's going to slow the spread of the virus. And so I'm encouraging my fellow Mississippians, Republicans and Democrats alike, even those who are going to vote independent in the upcoming elections. Let's work together. Let's put politics aside. Let's wear a mask. Let's stay in small groups. Let's not have big groups. Let's stay socially distanced. And let's not find ourselves even going into the winter in a scenario where our total COVID hospitalizations double, say, for over the next 4 to 6 weeks, which combined with the hospital trends that we're already seeing in non-COVID patients, which is not unusual for this time of year, by the way. Let's just protect our healthcare system. Let's work together. Let's protect ourselves and protect our neighbors. Yes, ma'am.
Dr. Dobbs, I believe that you and Dr. Byer spoke some to churches and where we stand with kind of compliance and safety measures and those, some last week. But where do we stand with that? Do you have concerns as perhaps people are getting more comfortable going back into the houses of worship?
Yeah, I don't have a precise view of what's going on, although we do get, I mean, Dr. Byers has some information about outbreaks, and certainly we see that. And that's really a prime place to spread it, right? Folks are happy to see one another, expressing their emotions, their fellowship, and singing. Singing's a bad way to spread it. I will say, though, I've had a couple of churches call me, and I've been disappointed, but I guess I haven't really understood, is what they said is, now that there's no mask mandate, I can't tell my parishioners to wear a mask in church. And I really thought that it would be something they could buy in on their own and take ownership and make sure they protect their folks. So I do worry about those locations, and especially in churches. You got older folks, you've got people who are singing, and guard is down. I think spacing and masking is especially important in those areas. And then also funerals and weddings, those are big ones too, and similar. So, if you're going to do a funeral, it really needs to be outdoors. The graveside is preferable. And weddings, keep it tight, close family. It's a sad thing. My own son got engaged, and they put off the wedding till 2022.
Yes.
Governor, there's a lot of people in Mississippi that have mask fatigue. They were not happy about the statewide orders when they were involved. And now whenever that was released, they rejoiced. Now we're starting to see some counties go back into your orders. How do you get those people back involved in masking?
Well, there's no doubt. There's not just mask fatigue. There is coronavirus fatigue. I would imagine that you've got at least 3 people sitting at this table right here that have a little bit of coronavirus fatigue. That's what many of us have spent at least hours and hours every day dealing with for the last 8 or 9 months. And so what I would tell you is, if you're tired of hearing about the coronavirus, I am too. If you're tired of talking about the coronavirus, I am too. Trust me, if you got to come spend a few hours every day with me looking at this data every single day, you'd get tired of that too. But we've done this now for the better part of 2020. We know that there are multiple pharmaceutical companies that are very, very close, it appears to me, to getting vaccines that could be very helpful in helping more individuals be protected from this virus. And we know that there are certain things that can work when taken together. No one individual measure is going to make this thing go away. But if we will wear a mask when in public, particularly indoors, if we will stay socially distanced, if we will not gather in large groups, because there's going to be individual spread from one person to another. But where we really find ourselves with real challenges is these events in which 1 or 2 people have it and spread it to 1 or 200, who then spread it to 1 or 200, and then and just because of the way in which virus spread works. And so, what I would say is, back in March or April, we were talking about shutting down businesses, shutting down the economy. Nobody wants to talk about the coronavirus anymore, and I understand it. But I do think that now that we are within the last 10 days of October, if we'll be smart, if we'll wear a mask, if we'll do the little things. And I'll tell you, every day I see some things that discourage me, and every day I see things that encourage me. I actually went to Nukes yesterday, and literally every single person in Nukes had on a mask. I was pleased to see that. And they had tables spaced out. And so certainly that's a good positive, and I think a lot of people are certainly tired of the virus, tired of hearing about it, but there's a lot more people that are doing their part. There are a lot of people in Mississippi that are continuing to make the sacrifice. There are a lot of people in Mississippi who are continuing to participate. And what I hope is, in talking through this with our fellow Mississippians, that we'll get even more participation, particularly in those counties where the spread is a little bit greater. We have counties, a few, that literally over the last 2 weeks had 0 cases. We've got quite a few counties with less than 20 cases. And so obviously in those counties, the risk of spread is a little bit less than it is in certainly these 9 counties that I have named, where they have seen more transmission than other counties. So if you're in DeSoto or Jackson or Lee or Forest or Lamar or Itawamba or Neshoba or Claiborne or Chickasaw, the risk is very high. If you're in one of the other 73 counties throughout the state, the risk is still there, and we still need you to help, and we still need you to participate.
Nick with Jackson Free Press has another question.
Hi, thank you. So I want to follow up on something that Dr. Dobbs said there, with some churches admitting that they can't justify requiring mask use in the absence of your order. That's something that I've heard personally myself many times. Not that people blindly follow government mandates, but that they use them as a guidepost to protect, for example, their businesses. Why doesn't that justify the order, knowing that helps? And I have a quick follow-up for Dr. Dobbs after that.
Well, I think anyone can certainly require masks in their business should they choose to do so. Anyone can require their parishioners to wear a mask. But look, here's the reality. For those in the higher risk categories particularly, but for all Mississippians, I strongly encourage you to wear a mask even if you're going to church. I don't believe that I have the ability, or any other governor has the ability, to restrict church services, but I do think that we can worship in a safe, responsible way, and the best way in which to do that is to limit crowd sizes. You can limit crowd sizes by having more church services. The weather's beautiful. Yesterday the weather was beautiful. It would have been a great day to have church outdoors. Would have been a great day to celebrate. Are we going to have to do things a little bit differently to minimize risk? Absolutely. And I wish that wasn't the case, but it is. But I think that everyone has to deal with their unique situations in their own unique way.
Nick, you can go ahead.
Hi, thank you. Dr. Dobbs, if there was one thing we could do to make Election Day safer, one thing that we are not currently doing, what would that be?
It's the same rules. It's space, small groups, and mask. And so whatever we can do to kind of make that work out is better, right? So the number of people might be a little bit difficult. Understand that, so that makes masks a little bit more important. And certainly I think people really individually following the rules that have been laid out by the Secretary of State will be important. What we found in our school setting has been, when you have structured activities where people are masked and separated, even if it's not 6 feet all the time, the structure, the order, and the masking works out quite nicely. We haven't seen much in the way of outbreaks when in classroom settings, and I think the analogy extends to voting and other things, is orderly, quick, masked sort of stuff will go a long way at making it a lot safer.
And speaking of, there seems to be this infatuation by some of you on making voting something different than it has been in the past. Let's talk about the numbers here. Mississippi has approximately, and I'm going to use approximate numbers here, and I don't have anything in front of me, but we have approximately 2,000 precincts. 2,000 precincts. We will vote approximately 1 million people. That means approximately 500 Mississippians will vote on average at each precinct. We're going to vote for 12 hours. My guess is that somewhere in the neighborhood of 25 to 30% of the people will vote absentee this year, but let's assume that they don't. We have 1 million people voting in 2,000 precincts, which is approximately 42 to 43 people voting per hour per precinct in a 60-minute time frame. I don't know about everyone else's precinct, and I don't know about my new precinct because I'll be voting in a new precinct this year. But in my old precinct, we had usually at least 6 different machines that we could vote on. So if there's, on average, 42 people voting at 6 different machines, that is approximately 7 people per hour voting per machine. Now, is it specifically, particularly evenly spread all throughout the day? Not necessarily. But there is definitely a manner in which we can go to the polls, as has been proven last Tuesday in Lincoln County, and Lawrence County, and Copiah County, and Walthall County, and Oktibbeha County, and Lowndes County, and like we did earlier in the summer up in the Mississippi Delta, where we had a 2nd congressional district Republican primary runoff. We can vote. We are going to vote in a safe way. People can go to the polls. They can protect themselves. We'll have adequate machines. We'll have adequate precincts. And while I know some people are certainly infatuated with this question, we can do it in a safe way.
All right, we have Bobby Harrison, Mississippi Today.
Hey, Governor, Dr. Dobbs, I have 2 or 3 quick questions. I'll just go ahead and ask those questions and let y'all answer them. Hopefully you can remember. Dr. Dobbs, just to begin with, you at the beginning of the press conference, you, I think, said some stuff about ICU units in larger hospitals. Can you, and I missed exactly what you said, can you say that again? Second of all, if you could explain, I also got confused, I'm a little slow today, I'm sorry. If you could explain, maybe so a kindergarten student could understand, or me, how the rapid testing is working in the school districts. I would appreciate that. And thirdly, it seems that over the past couple of weeks, there's been a big increase in the number of cases in the schools. Can you elaborate on that? And is there something that needs to be done there to kind of address that, or just where does that stand? I appreciate both of y'all taking time to answer these questions.
Yeah, so in the ICU, there were 9 major medical centers that had no ICUs in the state of Mississippi. It varies from time to time, but something we'll monitor. So they're not, some of them are in Jackson area, some of them are not, and that's all on our website. So we have, we do regular updates of the ICU capacity. On the testing for the school kids, our first level of deployment is going to be making them available in every county. And, we already have K-12 as being one of the immediate criteria for eligibility of testing. So if people want to get tested, or and we're referring them there as well, if they've been exposed as part of an outbreak, to go by the county health department and get tested and get a rapid and get a confirmatory. Well, sometimes you get a confirmatory PCR. So, so that's here. We're going to do it more often in more counties, and we're going to find partner organizations to do the testing. We're working on those mechanisms as well. It's not a test that can be just done by a layperson or even just a school nurse. There's complications to be done in the school. So we're rolling it out as stage 1 within the county health departments. And then you had a third question too. Oh, what was it? Now I can't remember what it was.
Bobby, can you repeat your 3rd question, please?
Yeah, I'm sorry. Yes, so it seems there's been a pretty big increase in the number of cases in schools over the past couple of weeks. Talk about that and what
we've seen steady increases in the number of students, mostly in the quarantine, and a lot of that's related to youth athletics. It's something we knew was going to happen. It's an unstructured setting. It's a place where kids are in the school bus, they're in the weight room, they're on the athletic field, and then when you have these situations, you have potential for a broader spread, because there's not one kid surrounded by 4 kids. It's one kid surrounded by 30 kids in random sort of order. So it's a real challenge. I would just like to reiterate what a great job the school systems have done in being true to this, and I think that's one of the reasons why they're still able to educate the kids. And then you probably saw some of the stuff about what happened in Lamar County, Summer All School had to take a break, and that seems to be related to an extracurricular social event put on by families and parents. That's the stuff that's really undermining us, is social stuff that we just don't have the, it's people, we got to be patient. It's just not the right year for a lot of that.
The only thing I would add, Bobby, to what Dr. Dobbs said is with respect to ICU capacity, one of the reasons that we're taking proactive measures today is as we're seeing, we know hospitalizations and we know ICU usage of COVID patients is a lagging indicator. And so as we see new cases tick up over a number of weeks, we start looking at total volume of ICU patients, both COVID and non-COVID, and get concerned because, for instance, on September 28th, we had 138 COVID patients in ICU beds. On Friday, we had 140. And so we didn't see really any major uptick over a 3-week period in the total number of COVID patients in ICU beds. Now, it stopped falling. Keep in mind that 140 is in comparison to 337 we had at the peak. So while the ICU beds are with COVID patients are not falling, they're not increasing rapidly yet, but overall usage of ICU patients was up to 745 there in late last week. And so it's the total volume of ICU patients, both COVID and non-COVID, that we are watching closely, that I am concerned about. And it's the reason that we made the initial point earlier today is that we are going to cut off non-elective surgeries statewide if ICU capacity is not available in our hospital system. Well, thank you to everyone for being with us today. We've been here a little over an hour. I do appreciate you showing up, for you to help us spread the word here throughout the state of Mississippi that this virus is real, it is contagious, it is still a risk. We do not yet have a vaccine. We're hopeful that occurs sooner rather than later, but we got to take additional measures from an executive order standpoint in the 9 counties that I mentioned today, but hopefully statewide we'll convince more participation by our fellow Mississippians. Let's work together. Stay safe out there, Mississippi, and God bless.